Warning for all cell phone users. Well, I guess that's all of us. Radio frequency radiation emitted by cell phones can cause cancer, according to a new federal study just released. Joining us now on the phone, oncologist in the Yale School of Medicine and professor, Dr. Vincent DeVita is here, as well as family doctor, Dr. Janette Nesheiwat. All right, so first, can you just tell me, this is possibly the first proof of many of our fears that having that cell phone up to our head all day, or if you do that, that it's bad. What are we learning from this?
Sandra, can you imagine a world without cell phones? We all live off of our cell phones. We work. It's such an important tool in our lives. In my opinion, there is not enough evidence to show hardcore data that cell phone use can cause cancer.
Okay, but
the type of radio frequency energy that's used for cell phone is like your microwave. It's like the light that we see. It's not enough to break down the chemical DNA to cause cancer.
Okay, so Dr. DeVita, what is your takeaway from this study? Because this was performed on rats, and there are findings that are causing concern. What do you make of it?
Well, I don't think the evidence is sufficient to cause any concern, really. I mean, it's mostly based on the assumption that radio frequency waves can cause some damage, but the damage is mostly heat. It's not like ionizing radiation. And if you look at all the studies that have been done in the world, there's just no definitive evidence that it causes brain tumors, which is the main concern.
So I guess
there's been no increase. If you look at all the data in our SEER database, we have a large database that the National Cancer Institute follows, a surveillance, epidemiology, and result database. Since 1992, there's just been no incidence increase in brain tumors that can be attributed to cell phones during that time.
But Dr. Nesheiwat, the concern was always we don't have a period of time long enough to really make any conclusion.
I think we do. Cell phones have been around for 25, 30 years. Okay. This is not like when you go and get an X-ray or UV light exposure in a tanning bed. It's low-frequency radio frequency waves. And in my opinion, moderation is the key. Don't be on your phone all day long. Smoking, eating French fries is more dangerous than cell phones.
Can I ask Dr. DeVita? But Dr. DeVita, I just even from a personal perspective, I had a very close family member who died of a grade 4 glioblastoma 5 months from diagnosis to death, and there's certainly more instances that you hear about anecdotally, even very famous people, like Senator Ted Kennedy, for example. So there has been no increase in these tumors at all. So what causes them then?
No, there's none. And you know, I mean, we have something like 12,000 cases a year in this country of glioblastoma. So people know people who get it. And since everybody uses a cell phone, you know, the assumption is, well, it must be the cell phone. But there's been no increase. You know, there was a study years ago, there was a thought to be an increase from exposure to petrochemicals. And when they looked at it, it really was an example of the use of new diagnostic techniques as opposed to causation effects. So I think you can't make the assumption that, I have no idea how often Ted Kennedy used his cell phone, but I doubt that had anything to do with it.
So, Dr. Nesheiwat, I know that another area of concern here is pregnant women are always really concerned because where do a lot of us wear our cell phones? On our hip. Is there any increased concern there?
You know, there's more of a concern for pregnant women who smoke and drink alcohol, who aren't taking their prenatal vitamins. Again, the evidence is it shows it's insufficient. There's not enough evidence to show that there's a direct correlation between cancer-causing tumors and cell phone use. So,
okay.
Moderation.
And I also want to get yours and Dr. DeVita's take on this, the deadly superbug with strains of E. coli making its first appearance in the U.S. Dr. DeVita, what is the threat here?
Well, I mean, the real danger, that infection that was reported was not lethal. But the real danger is that this gene can be transferred to other bacteria, so we haven't seen that so far. This is the first report, but there are plenty of examples of what we call superbugs, bugs that are resistant to almost every antibiotic, and it's a real serious problem in this country. So we have to be diligent, and we need more antibiotics developed by the pharmaceutical industry.
Wow.
But I think that's, as far as we know, that's just one case at the moment. I don't know.
Dr. DeVita, are you aware of, I mean, to what extent are the companies working on this?
Well, yeah, they're working on it. But it's not easy to develop drugs, and in this country we don't make it very easy. So I think we could use a little bit more flexibility in getting drugs to the market. Developing antibiotics is not my field, but I can tell you that in the cancer field, it's a very difficult problem to get drugs into the market with our current regulatory environment.
It's the overuse of antibiotics that's creating a huge problem in this country. A lot of patients think, oh, I have a cold, I'm sick, I need antibiotics, when it's really just a virus. Antibiotics don't treat viruses. So it's important for healthcare providers to educate their patients. Look, let's do this treatment plan versus antibiotics, and then based on your symptoms, we'll determine if you need an antibiotic. That definitely plays a huge role in antibiotic resistance.
Dr. DeVita, I want to ask you a quick question about in terms of the drug approval coming out of the FDA. Does having a new president, regardless of who it is, does that make a difference in how the FDA operates? Like, could we hope that the attitude by the FDA in terms of drug approvals could change?
Well, I don't know. I mean, usually what a new president can do is appoint a new commissioner with the Food and Drug Administration. We have a very good commissioner. I have no problem with him. So I don't think it's likely to make a big difference. And usually, since the commissioner is a presidential appointment, but has a staggered 6-year term, so that the term doesn't end at the time that a new president is appointed. So it has very little effect, because it's the mid-level staff of the FDA that really interpret the regulations. So I don't anticipate a big effect. I mean, the president has a bully pulpit, and if the president would make it a priority to mention and discuss, the problem and ask for accelerated drug approval, I think it would certainly affect attitudes.
Okay. Dr. DeVita and Dr. Nesheiwat, thank you to both of you for joining us in that breaking news this morning. Good to have you.